Okay, so I'm going to walk into the patient room, um, wash my hands. I'm going to say hi. My name is Ruth Gutierrez. I'll be your nurse for today, technically tonight. I'll be doing a full physical assessment on you. Can you please tell me your name and your birthday?
My name is Samuel Gutierrez. I was born April 9th, 1999.
Fantastic. Can you also tell me the current year and where you are at right now?
The year is 2021 and I'm at home.
Fantastic. So he is cognitive times 4 because he was able to tell me all that information. While I was listening to him talk, I was listening to his speech, and it was not slurred, it was not stuttered, it was clear and precise and appropriate volume for the setting. As I look at him, I see that he is a healthy young man, on the thinner side, but a healthy thinner. I see that he is well groomed, and that he wears glasses. So he has some vision impairment. Is it okay if I touch you?
Go ahead.
Great. So I'm going to start my physical assessment, first looking at his hair and seeing that it is all there and that, he's not losing any hair, because that would be odd for a person his age. Also that there are no lumps or bumps or redness lesions within his scalp, and there are not. I'm also gonna I'm also gonna take a look at his face and at his eyebrow hairs, eyelashes, and mustache, beard hair, and see that they have that it's all there. There are no missing chunks. And it's all full. Now I am going to touch your face. Is that okay?
Mm-hmm.
Okay. So, can you feel this?
Mm-hmm.
Can you feel that?
Mm-hmm.
Fantastic. I'm going to press on your jaw. Can you open it for me? And close. Okay. Can you raise your eyebrows really high for me? And then puff out your cheeks. Great. Now I know that cranial nerves 5 and 7 are working because he was able to do all those movements with his face and he was able to feel me touch him. Now I am going to examine your eyes. So is it okay if I take off your glasses?
Go ahead.
I'm going to press on his sinuses and tell me if there's any pressure or pain or discomfort. No?
Mm-mm. No.
Fantastic. I am looking at his eyes and I see that his pupils are appropriately dilated and evenly, and they are both the same. I literally just forgot the term of that, and you can't help me. Is it okay if I shine a light in your eyes?
Sure.
Okay, I'm going to shine a light in your eyes. Look at me, not the light. Okay. His pupils are equal and reactive to light, so they follow the pleura. I need you to look at this pen. I need you to follow it with your eyes without moving your head, okay? Fantastic, thank you. Now I know that cranial nerves 2, 3, 4, and 6 are all working because his eyes, because he can see and his eyes are able to move. I'm going to look in your nose. I see that his nose has no deviated septum. It's nice and straight. And then when I look inside, there is no excess mucosa, but it's a little red. Have you been having allergies?
Yeah.
Yeah. So his allergies may be the reason why his nose is a little red inside. We're going to do a smelling test. So if you could close your eyes. I'm going to plug one of your nostrils, and I'm going to ask you to see if you can smell it, okay?
Mm-hmm.
Can you smell it?
Mm-hmm.
You can smell that?
Mm-hmm.
Great. What was it?
Vicks.
Vicks Vapor Rub. You are correct. I'm also going to ask to plug your nose again, and can you breathe in deeply? Breathe in deeply again. Now we know that cranial nerve 1 is functioning because he is able to smell things. Now I'm going to touch around your ears, and you're going to tell me if you feel any sensitivity. Okay? Thank you. Does it hurt?
Yeah.
His ears do not hurt when I touch them, and they are an appropriate shape. Can you hear this?
Mm-hmm.
And hear it on the other side?
Mm-hmm.
And you do the same touch test on the other side as well. You would touch around his ears to make sure that there is no pain. But now that I've done the sound test, we know that cranial nerve 8 is functioning because he can hear. Now, can you open your mouth for me? Great. I see that his teeth and his gums are all nice and healthy. His lips are an appropriate color. They are pink, and they don't have cyanosis or anything like that. And his tongue is an appropriate pink color as well. Can you stick out your tongue for me? Great. Can you go all? Fantastic. And can you swallow for me? Fantastic. So now that I know that cranial nerves 9, 10, and 12 are all working because there's inflection when in his uvula, whenever he says ah, his tongue comes out midline, and he's able to swallow. Now I'm going to ask you to shrug your shoulders against my hands. Great. Now push your head against my hand. Great. On the other side. Fantastic. Now I know that cranial nerve 11 is able to function, is working because he is able to push against resistance. Now that we're done with head, we can move on to lungs. So, yeah. Not yet.
Okay.
I've been looking at his breathing, and he's not using any accessory muscles. His depthness in breath, his rate in breath, are all appropriate for him just sitting down and doing nothing. Sorry. His chest cavity looks appropriately shaped. There's no abnormalities. And can you breathe for me? Both sides lift whenever he breathes. So now if you could turn your back towards the camera, please. I am going to do the like vibrations test when he says 99, and I feel, and my palms are on his back. So when you feel my palms on your back, please say 99.
99. 99. 99. 99.
Fantastic. I could feel his chest, his back vibrate, but not too much, just an appropriate amount. I also see that his spine is completely straight and there is no deviation or anything like that. Now I am going to check for breathing sounds. And we're going to do this across to make sure that we're listening to both sides to see that they're both sounding evenly. Okay, so whenever you feel my stethoscope, please breathe in and out for me, okay? And I forgot to mention this, but you're going to be going around the scapula, not on top of it. You're also going to be doing the 2 auxiliary points on both sides. I'm not going to do this side because obviously you can't see it, but you would do both sides. So breathe in for me. And breathe out. And again. Great. And again, both sides. Now Sam, you're going to face the camera. Thank you. You're going to do those same 8 respiratory points on the front of his chest, making sure that you do not touch the... I forgot to do a part. Well, we'll finish this up. It's okay. Making sure you don't touch the clavicle because you're not going to be able to hear anything. So in and out. In and out. Keep going. I'm recording. So the part I forgot, which I apologize, is his lymph nodes, which is the submental, submandible, tonsils, and please tell me if any part is tender. His pre-ocular, his not ocular, auditory, his post-auditory, it's not the correct word, his occipital, his cervical lymph nodes, the chain, and then his supraclavicular. And you weren't able to see any of that because my other hand, but here, here, in the back. But yeah, that's the part I missed. My apologies. After checking breath sounds, we are going to go to the carotids. I'm first going to palpate. And you're not going to do them bilaterally because you don't want your patient to pass out. So we're going to do one side. And you do this for about a minute. You feel a pulse. But we don't have time for that. And on the other side, again for about a minute. And then you're going to do the same carotids, and you're going to check for, that's so loud, you're going to check for bruits while he's holding his breath. So hold your breath. No bruits. Breathe. Okay, hold your breath. And no bruits. After checking the carotids, we're going to go check for heart sounds, starting at the aortic. And this bed is a normal bed, so it cannot go up. So I'm going to sit down on it. Not the most, nope, stay. Not the most professional, I know. We're going to start at the aortic, which is the second intercostal space. On the left side, right side, right side. We're going to go onto the left side and listen to the pulmonic, or pulmonar space, or pulmonar pulse, in the right intercostal, second intercostal space. And then we're going to go one down to the third intercostal space in the Erb's point. Another one down to the fourth intercostal space in the tricuspid. And another one down in the fifth intercostal space in the mitral valve. S1 and 2 sounds were heard and there were no murmurs, so my brother has a nice and healthy heart. Now we're going to go to gastrointestinal. So if you could lie down for me. We are first going to auscultate his abdomen. You would do this for about 5 minutes each section, 3 to 5 minutes each section. But I am not. I'm going to start in the lower left quadrant because that is where you are most likely to hear gastric sounds. And if you can hear gastric sounds there, then you don't really need to hear everywhere else, but it's nice for you to check. So, okay, you can be seen. I have my things in the wrong way, don't I? Yeah, I do. Nice stomach sounds. Mm-hmm. Great. Again, you'd want to do that for 3 to 5 minutes on each quadrant. Now we're going to palpate each quadrant, and you're going to tell me if you feel any pain or discomfort when I palpate, okay? So starting in the lower left quadrant. Any pain?
Nope.
Okay, over here?
Nope.
Up here?
Nope.
And over here?
Nope.
Fantastic. How are your bowel movements?
All of them are fine.
Mm-hmm. And when was your last bowel movement?
This morning.
Great. And how's your urinary?
Pulse is good.
So you pee fine? Great. Done with the gastrointestinal, and now we're going to go into the musculoskeletal. So I'm going to start with moving your joints to see how many points of flexion they have, okay? No, you don't need to. So you're going to move. I see that he has all points of flexion in his shoulder, and you do this on both sides. His elbow. He has nice points of flexion. His wrist moves nice, and all his fingers. And again, you do it on the other side. His hip. Relax.
Mm-hmm.
You can go all the way up, all the way sideways, and then back down. His knee can go up and down, and they can move side to side. His ankles that you can't see, there we go. He can move around in a circle, and his toes. And there's no pain anywhere. You check for pain, for sensitivity. Next we are going to do your capillary refill. So take your hand. I'm going to press on a nail for a few seconds. And then I'm going to see how fast his nail refills back in pink. And it was very quick, so we know that his capillary refill is adequate. We're going to do that to the other hand as well, but not today. You're going to again do that to the feet as well. You're going to press on the toe. You're going to let go and see how fast the capillary refill takes. And his toes are a little cold right now, so it took a little longer. But it's still an adequate amount of time. Now we are going to do pulses. So we're going to do the brachial pulse, and you'll feel this each a pulse for a minute on both sides. The ulnar pulse. The anterior tibial, no, post-popliteal pulse. And then the pedis pulse. And again, both sides, whole minute for each one. We're also going to do a strength test. So if you can grab my fingers on both hands, squeeze. Fantastic. You would do this on both feet, but you can't see both feet, so I'm just going to show you one. Can you push with resistance? Push with resistance. Fantastic. Now we are going to do the tendon reflex. So I'm going to grab my pen light because I don't have one of those little hammers. And I'm going to do his brachial, his ulnar, again on both sides, his popliteal, his anterior tibial, or his Achilles, and then we're going to do the Babinski test. And it was a negative Babinski. His toe was curled in. And that's the test, that's the what you want. All his reflexes were fine. Now, can you stand up for me? Stand up.
Oh.
Can you walk from your door back over here to me, please? His gait was normal and at an appropriate pace. There was no wobbling or limping. Now can you do me a favor with your eyes open? Put your arms out wide. Put your finger to nose. Finger to nose. Okay, now close your eyes. Finger to nose. Finger to nose. Okay, now open your eyes again. Can you put your shin or your heel to your shin like a cricket? Okay. And do it on the... I can't do it on the other side because my foot's messed up. But do it on the other side. Fantastic. And last test, can you put your feet together? Hands next to each other. Close your eyes. Doing a Romberg's test to make sure you're not swaying too much. And you're not. There's a tiny bit of a sway, but that's perfectly normal. You are allowed to sit down. That is all I have in my memory. So, thank you, brother, for being my patient. Is there anything else you need?
Nope.
Are you comfortable?
Yes.
Fantastic. I'm going to wash my hands, chart what I've discovered within my patient, and then leave. Thank you.